Sometimes, you know exactly why your back is hurting. Maybe you lifted something awkwardly and felt the pain right away. Or maybe your doctor has been warning you for years that your bad posture would lead to lower back pain. But many times, the source of our back pain can be a disheartening mystery. The area of your back that is called the lumbar spine is in your lower back. This part of your spine plays a crucial role in supporting the weight of your upper body. It's also responsible for most of our everyday movements, such as bending, twisting, and coordinating the muscles in your hips, pelvis, legs, and feet. This is heavy and repetitive use of the bones, muscles, ligaments, discs, and nerves found in this part of your body. And why the area is so susceptible to injury or wear and tear over time, resulting in pain in the lower back. Symptoms that define lower back pain includes dull ache in your hips and/or pelvis, muscle spasms or tightness, sharp, tingling pain that starts in your lower back and travels down one leg, also known as sciatica, pain that worsens with sitting and quickly improves while walking, pain that is noticeably worse in the morning. Usually, a person experiences some combination of these symptoms, which can develop suddenly or over time. This explains how lower back pain can feel like it comes and goes, but if the underlying problems are not treated, in reality, the condition of your lumbar spine is getting progressively worse over time. Lower back pain symptoms can vary from one person to the next, as well as the underlying cause of the pain. Let's take a look at some of the most common causes. First of all, there are two types of back pain, acute and chronic. Acute back pain develops suddenly, often because of an identifiable injury. It often resolves within a matter of days, but may last up to 6 weeks. Chronic pain tends to develop more gradually over time, and it may become progressively worse. It's defined as pain that lasts at least 3 months, or that occurs intermittently over 6 months. Whether your symptoms are acute or chronic, you deserve rapid pain relief. Anytime back pain lasts more than a few days, talk to a doctor or a qualified healthcare practitioner about your back health. Like most other types of joint pain, the problem usually begins with a strain or sprain. Because your lumbar spine is put to work throughout most of your waking hours, your lower back can suffer injury from sprain or strain. You can also experience an acute injury after a fall, lifting something too heavy, or from playing contact sports. The treatment for acute back pain is fairly simple and can include pain and anti-inflammatory medications, muscle relaxers, ice to help reduce inflammation, heat to promote healing, and rest or avoiding strenuous activity until the pain recedes. If your lower back pain persists despite these options for treatment, it may be time to be evaluated for chronic lower back pain. We hope you see the value in this information, and will smash the like button. Now we will cover the most common causes of chronic lower back pain. Chronic lower back pain is less likely to be caused by injury to your muscles and ligaments. It is more likely to be related to issues with the lumbar discs, nerves, and joints of vertebrae. Most commonly, osteoarthritis and degenerative disc disease are the underlying cause of chronic lower back pain. However, chronic pain can also be caused by accident-related trauma and severe stress. Let's consider degenerative disease and how it specifically causes chronic pain. A serious and common cause of chronic low back pain is a condition called herniated disc. Your lumbar spine is comprised of 17 bones, called vertebrae. These vertebrae are stacked on top of one another. Between each joint lies a cushiony disc, which is designed to absorb and displace the pressure placed on these bones. Each disc is made up of an outer rind and an inner gel. A disc becomes herniated when the inner gel slips or squishes beyond the outer rind. This bulges the inner gel to press on surrounding nerves, and this is what causes the pain. A herniated disc can be the result of trauma or age-related wear and tear. In either case, the pain is significant. Another cause of chronic lower back pain is called facet joint damage. The joints connecting the vertebrae that make up your lower back are called the facet joints. Designed to protect your spine from compressive force and stress, over time, the cartilage in the facet joints break down, leading to lower back pain. Degeneration of facet joints can be caused from constant poor posture or repeated overuse. Facet joint damage is most often caused by osteoarthritis, which can lead to inflammation, stiffness, muscle spasms, and pain. In addition, when damage to a facet joint presses against a certain nerve, this can lead to a painful condition called sciatica. Lumbar spinal stenosis occurs when the spinal canal in your lower back narrows, placing pressure on nearby nerves. It can be caused by the formation of bone spurs, thickening of a ligament, or degeneration of a lumbar disc or joint. Spondylolisthesis happens when a lumbar vertebra slips forward over the top of the vertebra below. This places excessive force on the lumbar disc that is separating the two vertebrae. As the lumbar disc deteriorates, it can cause lower back pain. If the lumbar disc flattens from this type of force, it can lead to nerve pain and sciatica. It's important to know when to see a doctor or a specialist for lower back pain. As we mentioned earlier, if you're experiencing lower back pain that's not responding to rest or self-care, it's time to consider seeing your doctor, who will most likely refer you to a specialist. A spine specialist will perform a physical exam as well as take one or more imaging scans to diagnose the root cause of your lower back pain. Depending on your diagnosis, the specialist will develop a treatment plan. The first priority will be to alleviate your pain, then recommend therapies that can help restore your function as fully as possible. We have enjoyed bringing you another video, and thank you for watching this to the end. The tips and suggestions mentioned in this video are for general information purposes only, and should not be construed as professional medical advice. If you are over 40 and have questions about low back pain, it's important to consult with your physician to ensure that you have a clear understanding of your personal situation from a medical or mental health standpoint. If there is a health or wellness subject you would like to know more about, leave us a comment and we'll be happy to put together a video.